Hello students, now we are going to discuss a condition, which is a neurological condition, a rare condition. It's known as hydrocephalus. So hydrocephalus, the name itself implies hydro means water. Cephalus is brain. So water is otherwise called as fluid. So fluid content or fluid accumulation in the brain is called as hydrocephalus. Usually we have a fluid in our brain which is a cerebrospinal fluid that is needed for our normal brain function. So which will be in a dynamic way, which usually flows and it absorbs in a routine way. But if there is any obstruction or if there is any malproduction in the cerebrospinal fluid in our brain, there happens a condition called hydrocephalus. So today you guys are going to discuss about this condition. So I need each of you to be actively participate in explaining the features and the pathophysiology, how will diagnose the hydrocephalus and what is the medical management available for it. So you guys have to actively participate in this. So here is your condition. Go ahead. So who is going to tell the introduction about it? Yes. Please go.
Hydrocephalus is a clinical condition that characterized by accumulation of cerebrospinal fluid in the brain ventricles.
Yes. The next is CSF. Yes. CSF. What is CSF and how the CSF has produced and what is the normal rate of it and how it will get absorbed. The normal dynamics of it will be explained. Yes.
So CSF, which is also known as cerebrospinal fluid, it is produced at 500 ml per day, which is 35 ml per minute. Okay. So what happens is, this CSF is produced by the polar plexus present in the lateral, third and fourth ventricles. It flows in the caudal direction in the ventricular system and it exits into the subarachnoid space via foramen of Naxta and foramen of Hydrocephalus.
Yes. Good. So next.
It's the causes of
Yes, causes. So there are multiple causes for hydrocephalus and it's a rare condition. So the normal dynamics of CSF will not get easily disturbed. So if there is any major cause, only the hydrocephalus will occur. So what are the causes?
majorly there is of two types, communicating and non-communicating. So in communicating it's a non-obstructive hydrocephalus, which is for example we take meningitis. So it is a non-communicating hydrocephalus. In non-communicating, for example it is a tumor. So it is an obstructive hydrocephalus.
Yes, if the tumor is obstructing the flow between the ventricles, so there will not be any flow of the CSF. So once the tumor has happened or anything that obstructs the flow, that CSF will be accumulated there and it will enlarge the area which it is present and it will compress the neighboring area of the brain. So the pathology or the condition is not only because of the CSF accumulation. So because of the CSF accumulation, what is the direct effect on the brain? There occurs the clinical features.
By that it will also increase the
Intracranial pressure. Yes, so that is where the severe headache and the intolerable weight in the head occurs. Yes. So the next is clinical features. So what are the clinical features we can see?
Which is like increase in the circumference. So first main clinical feature, and then sun setting, which means the head circumference is increasing. The eye will be sun setting. The main is Mason sign. What is Mason sign means? While tapping the frontal bone, there will be a crackpot sound will be heard. And then followed by only vomiting, nausea, severe headache. The next one, investigation. Investigation first is neuroimaging, which is CT scan and MRI. In that we can know about the CSF. Okay. Then followed by spinal tap. It's an investigation.
How the fontanelles will look in the babies or in the kids, the fontanelles will not be completely closed, right? So that there is an easy way to expand the fontanelle and there is an enlargement of that. So in the children with the hydrocephalus, you can see a face with a tiny the enlarged, and the fontanelles that will not be in a closed state, that will be the open state. Once if you palpate the center of the head, so that fontanelle will be going up and down, and you can see the pulsative there in the fontanelle. And as I said, the crackpot sound, that is because of the accumulation of the fluid inside a bony tissue. Yes, so the bone with the fluid is considered as a pot with the water. So once you tap on a mud pot with the water, you will hear a sound, that crackpot sound. That will be similarly seen in a head with a hydrocephalus where there is a fluid accumulated inside. Okay. So what are the next things? Management.
For acute stage, you can do like 7 elements in the range for acute stage. Then for chronic, we can do like ventricular or cranial.
Peritoneal shunt. Ventriculo-peritoneal shunt. So I'd like to explain what is ventriculo-peritoneal shunt. Ventriculo, the name implies ventricles in the peritoneum is the abdominal cavity. Okay. So abdominal content will be void out as a urine, as a defecation. But in the brain content, if there is an excessive fluid, there is no space to get out of the fluid. So once if there is some tissue got damage in the brain, so that the fluid can come out of the ear or the nose. Okay. So that what happens in shunting? So to the way from the ventricles to the abdomen, there is a placing of a minute tube which does not disturb the normal mechanism. Okay. So the tube which passes from the brain to the peritoneum will drain the fluid from the ventricles to the peritoneum. There the abnormal fluid will get absorbed and it can be void out as a urine and some can be passed out to the defecation also. So since this is very critical, crucial procedure, the patient will be having some chances of infection in shunting. Since the abdomen is more prone for infection, so the infection can spread to brain also. So this is the only way to control the fluid dynamics in the brain. So that is, there is no other criteria to treat that patient. So this is used in treatment strategy, but it's very rarely used. In the obstruction cases and all, there is no need of shunting. If you remove that obstruction, if you remove that pneuma, that there will be a way for that fluid. Okay. So in hydrocephalus cases, you see the child will be always cranky because of the pain and because we can't able to lift the head up. So always cranky. So in physio, our role, we can able to only symptomatically manage. And in the children and all, once if the children is calmed down, there we can treat the musculoskeletal conditions. So this hydrocephalus, once if it compresses the cerebellum, there occurs the gait disturbance, balance body. Only if it is compressing the cerebrum, then there will be a